Any other witnesses in support?
Mr. Chair and members, Barry Broad on behalf of the Teamsters were co-sponsors of the bill. Suffice it to say the workers' compensation system went into effect in 1911 when it was workman's compensation. It's just a very old statutory scheme that has built-in biases, and there's clearly built-in biases against women, and they've been around in the system too long, and they need to leave the system. And women should not be penalized for the immutable characteristics of being a woman any more than a man should be penalized, and they aren't, for the immutable characteristics of being a man. So we urge an aye vote. Thank you.
Thank you.
Mr. Chair, members, Deanna Johnson on behalf of the California Nurses Association. This bill is very important to our members, and we urge your aye vote.
Thank you.
Shannon Smith Crowley, representing the American Association of University Women for California, in support. Urge your aye vote.
Thank you.
United Food and Commercial Workers, 150,000 of workers throughout the state of California. Over 62% of our workers are women. We're in support.
Mr. Chair, members, Christy Baum on behalf of the California Professional Firefighters, in strong support.
Mr. Chairman, members, Randy Perry with Aaron Reed and Associates on behalf of PORAC in strong support.
Thank you.
Kirk Blackburn on behalf of the United Nurses Associations of California, in support.
Thank you.
Steve Catolica, representing the California Society of Industrial Medicine and Surgery, the physicians who treat and evaluate injured workers, in support.
Thank you. Two witnesses in opposition. We can make room for them. Please step forward.
California State Association of Counties. We're in opposition to AB 305. This bill is largely about limiting the opportunity of employers using apportionment to ensure that they only cover the workers' compensation costs that are attributable to the injury that actually happened because of work. When an injury is determined to be permanently disabling, a doctor is required to determine the causation of that injury and then what percentage of that injury was actually caused by non-industrial factors. Prohibiting the use of apportionment on the conditions listed in AB 305 is going to exponentially increase our workers' compensation costs and expose us to major litigation. As your analysis points out, the Labor Code sets very stringent guidelines for doctors to use apportionment and to determine if it's reasonable. It has to be based on causation, it cannot be speculative, and the reasonableness of that apportionment has to be clearly explained. This leaves no room for gender discrimination. Evidence isn't showing gender discrimination bias in workers' compensation apportionment, and another thing your analysis says is that doctor errors in apportionment is not rampant. There's no evidence to show that. Do physicians sometimes make mistakes? Sure, they're human. There's an avenue for injured workers to go through to correct that mistake. It's through the Workers' Comp Appeals Board. They can get it overturned there if it's found that the apportionment was indeed unreasonable. California currently ranks #1 in workers' compensation costs in the country. Counties can definitely feel the effects of these rising costs. That's taken right out of the pots of the basic services that we provide to our residents, including public safety, healthcare services, et cetera. So for those reasons, I would appreciate your opposition to the bill.
Thank you, Mr. Chair and members. Jason Schmelzer here on behalf of the California Coalition on Workers' Compensation and CSAC Excess Insurance Authority. I want to take a moment just to recognize the seriousness of this issue. Discrimination in the workers' compensation system on any level is frankly unacceptable. I think in this instance, we just have a disagreement with the author about whether or not there is systematic discrimination in the system or whether or not the current law allows it. So there are two portions of the bill. I want to go ahead and acknowledge both of them separately. First is the permanent disability rating aspect of the bill. As it's pointed out in the analysis, permanent disability is based on the American Medical Association guides. They're objective, evidence-based, peer-reviewed, nationally recognized. They've been in statute for years in the state of California, and the reason is precisely what I just listed. They are the most objective analysis of impairment that is available to us. They measure impairment, as it indicates in the analysis, the loss of use of a body part relative to the whole person impairment. Again, the analysis points out we're not necessarily looking at medically comparable, to quote the analysis, body parts. And when you do look at medically comparable body parts, according to the analysis, there's parity in the ratings. Secondarily, currently in California law, you can do what's known as rating by analogy, which means if the impairment for one body part looks and acts and serves more like the impairment from another body part, you can use the chapter for the other body part to rate. It was part of case law, the Alvarez-Guzman decision, and it was codified in SB 863. So I think what we have here is just a disagreement about whether or not the objective rating manual that's used in the system and was passed by the legislature actually leads to any sort of discrimination when you're looking at medically comparable body parts. I think in a lot of aspects in the workers' compensation system, what we really benefit from is deep analytical analysis. It's been what has served us in reforming the system recently through SB 863. And I think if we could have the Joint Labor Management Committee, the Commission on Health and Safety and Workers' Compensation, examine this issue, we would be more than happy to look at the results. Again, going back to the first point I made, discrimination, systematic, intentional, unintentional, or otherwise, is just simply unacceptable in the workers' compensation system. To the second portion of the bill on apportionment. Apportionment is...
We're trying to leave it to about 3 minutes a person.
Okay.
So
One more point, and then I'll quickly and gladly wrap it up. I just want you to imagine two buckets. Let's take all other factors out of the conversation. There is disability that is caused by the workplace, and there is disability that is not caused by the workplace. What this bill does is it very intentionally takes disability that is not caused in the workplace, medically, legally, and it moves it into the bucket that is caused in the workplace. So what we're asking employers to do is to pay for disability that is medically and legally not caused in the workplace. That fundamentally alters the nature of the workers' compensation system, and it's just something that we can't support. So with that, we respectfully oppose the bill and ask for your no vote. Thank you.
Thank you. Any others in opposition?
Thank you, Mr. Chairman. Senators Julianne Broyles here on behalf of the California Association of Joint Powers Authorities. We agree with the points on the apportionment and the impact this bill would have. Ask for no vote.
Mr. Chair, members, Jeremy Mers on behalf of the California Chamber of Commerce, also in opposition.
Thank you.
The chair, members, Ken DeWorth, the National Federation of Independent Business, and we're in opposition.
Alicia Lewis of the League of Cities in opposition.
Phil Vermeulen, representing Allied Managed Care and Acclimation Insurance Management Services, in opposition.
Amber King with the Alpha Fund, also in opposition.
Dylan Gibbons with the California Special Districts Association, also in opposition.
Don Chinsky on behalf of the Western Occupational Environmental Medical Association, in opposition. Appreciate the quality of the staff analysis.
Mr. Chair, members, Steve Kawamura on behalf of the Board of Supervisors of Los Angeles County and the Board of Supervisors of Marin County, in opposition.
Thank you. Seeing no others, do we have any questions from committee members? Any questions from committee members? Oh,